Guys, so this week we're going to be talking about hair removal from chapter 22. Some of the things that you guys are going to learn this week is how to explain the significance of a client intake form as you're using it in hair removal services. You're going to be able to name the conditions and contraindications of hair removal in the salon. You're going to be able to identify and describe the 3 methods of permanent hair removal, and you're going to be able to list the 8 methods used for temporary hair removal. Now, as I am recording this video, you guys are actually going to be learning hair removal today in lab. So once you see this lecture, you guys will have already learned the procedures. So the chapter should be a little bit easier for you, and that should connect some dots for you guys. So let's start on why do I need to learn hair removal? Okay, so removing unwanted hair is primary concern for many clients. Being able to advise them on various types of hair removal is going to enhance your ability to satisfy those clients. Offering clients hair removal services that meet their needs and they can be scheduled while they are already in the salon can be an extra service that you guys can offer. That's extra income for you guys. Learning the proper hair removal techniques and performing them safely makes you an even more important part of the client's beauty regimen. Learning the proper hair removal techniques and performing them safely makes you even more important of the client's beauty regimen. So in order to do these services, we have to make sure that we do them safely and put the client's health first. This is a very lucrative service. I want you guys to feel comfortable in whatever you decide to do, whether it's hair, nails, skin, waxing, natural hair, whatever you guys want to do, or a little bit of all of it, that is fine. But I want you guys to feel comfortable enough that you can go into a salon and provide these services. Now you can get extra training on these services. We're going to show you a little bit of full body waxing. You can take that one step further and get some continuing education on that. Speed waxing, so to be able to go somewhere and be able to speed wax. The European Wax Center is one of our people who come in and teach classes for us. The last class we had was virtually. I'm not sure that you guys were on the advanced clinic floor at that time, but that is an awesome place to work. They do nothing but waxing, and they do speed waxing. So you see more clients, therefore you have more income coming in as well. Okay, so one of the fastest growing services in the salon and spa business is hair removal. Once restricted to an occasional lip or brow service, a growing number of clients now want to have their entire face, their arms, their leg, all of those bare of hair. A Brazilian, a bikini wax, all of those are very, very popular. Body waxing has gained a tremendous amount of popularity in the last few years. Many clients now have body waxing performed as regularly as getting their hair cut or colored. That's very true. I myself go about every 6 weeks. So it is a very lucrative service because people are going to spend money on it. Okay, hirsutis, also known as hypertrichosis, is the growth of an unusual amount of hair on parts of the body normally bearing only downy hair, such as the faces of women and the backs of men. Hirsutism is excessive growth or cover of hair, especially in women. The most common form of hair removal in salons and spas is waxing, but with the popularity of these services on the rise, many different methods are now coming into play. We're going to talk about tweezing, we're going to talk about threading, we're going to talk about sugaring, we're going to go even, a step further in the laser hair removal, electrolysis, all of those things we're going to talk about in this chapter. Many men are now frequently requesting hair removal services. That's very true, especially athletes. You would not think that, but it makes them faster. A lot of men are doing that. The nape of the neck, chest, back, they are the most frequent removal requests for men. A lot of bodybuilding. I used to have some of those clients that I would do their entire back and their chest. A lot of men like to get the back of their nape done when they get a haircut because it doesn't come back as fast as when you do it with your hair trimmers. Okay, so let's talk about consulting the client. Obviously, this is, the most important part of the service is the client consultation always. Be sure to perform a consultation with the client prior to the hair removal procedure. Have the client complete the intake form, which is used in all skincare services, and it is a questionnaire that discloses all medications, both topical and oral, along with medical issues, skin disorders, or allergies that could affect the treatment. Okay. So, name the contraindications for hair removal. Okay. Some medical conditions and medications may cause the thinning of the skin or may make the skin more vulnerable to injury. Waxing clients with these conditions could cause unnecessary inflammation or severe injuries to the skin. So a contraindication means that there's a problem and I cannot proceed with my hair removal service. Okay. Accutane. A contraindication would be present if a client has been using Accutane within the last 6 months. Accutane is a very, very strong medication that treats acne. It has been on the market for years, and this causes your thin to release skin. Your skin is very, very sensitive when taking Accutane. So if a client has had Accutane in the past 6 months, please do not move forward with their hair removal services. Blood thinners. Any blood thinning medication, you see this a lot with pretty much anybody. I take a blood thinner, but a lot of your older clients are going to be on blood thinners. Also, a lot of your older clients are going to have much thinner skin, which could cause injury to their skin if you do not do the service correctly. Chemotherapy. Of course, that is a treatment for cancer, chemotherapy, or radiation. Autoimmune diseases. The biggest one that we see is any autoimmune disease that causes the thinning of skin, or the skin is more vulnerable in the sense that it cannot receive these treatments. But a very specific autoimmune disease that we see this in is lupus. Being on prednisone or steroids. And this could be anybody, you get a bad sinus infection or pneumonia, the smallest thing can cause you to go onto a steroid drug. And most of the time that is prednisone, but any steroid. Skin diseases. If your client is suffering from psoriasis, eczema, or other chronic skin diseases, hair removal is not going to be an option for them. Skin lesions. These are pustules, papules, any other skin lesion in the area to be waxed. Sunburn. Obviously, you have to be very careful. The skin is already very sensitive, so you would not want to wax anybody that was sunburned. Cosmetic surgery, if they have had cosmetic recently, or reconstructive surgery. Laser skin treatment. Okay, this could be laser for your skin. It could be there's so many different types of lasers now that you can use in the med spa, so you want to make sure you are well aware of what services your client does receive. Varicose veins. These are very, very thick veins. They make your skin, you can see them through very much, and they are very present. There's not much room between your skin and these varicose veins. You could easily cause injury to somebody who has a varicose vein. Bleeding disorders. If they are hemophilia, or if they have circulatory conditions, anything like that. And any other questionable conditions, any other medical conditions that are on their card that you are unaware of or you need to do research on, definitely hold off to protect yourself and the client. Okay, so conditions that prevent facial services. Okay, guests should not receive waxing services if they have rosacea, if they have very sensitive skin, cold sores, recent chemical peels such as a glycolic or salicylic acid, or recent microdermabrasion. If the guest is using a topical exfoliation such as Retin-A, Renova, Differin, or any other medical peeling agents as well. If a guest has had a recent laser skin treatment, surgical peel, any of those, you also need to be aware of that. So how do we do that? Again, we have been through chemicals this semester. We have been through hair coloring, several of the chemical services, perms, relaxers, all of those. So you guys know how important this client intake form is. It looks a little bit different when you're talking about skincare, in particular waxing. So make sure that you have the right questions, that you ask the right questions to get the information that you need. Make sure you read over this when the client gives it to you, and that you are very well prepared to ask them anything that you may need to know. Okay. Also, you guys are very familiar with the release form for waxing. So this has, and I would do this every single time that they came to get a service. I know that when I go to the med spa, it does not matter if I'm there for waxing, if I am there for a laser treatment, whatever it is, every single time I have to sign a release form. Okay, so permanent hair removal. Permanent hair removal methods are going to include electrolysis, photoepilation, also as light-based hair removal, and laser hair removal. Okay, electrolysis. That is the removal of hair by means of an electric current that destroys the growth cells of the hair. So electrolysis is actually the most permanent, and we're going to get into that in a little bit. Photoepilation uses intense light to destroy the growth cells of the hair follicles. This is also called IPL, intense pulsing light, and again, it destroys those growth of cells in the hair follicle. Laser hair removal is another method for rapid removal of unwanted hair. This is when a laser beam is pulsed on the skin, impairing the growth of the hair. So this does not destroy. This again impairs it. It stops the growth. You do this in the growing stages of the hair. We're going to talk about that a little bit later in the slides. But for instance, I have been getting hair removal done for probably 11 or 12 years. With that being said, I have to go every 8 to 12 weeks. It just depends on how my hair is doing. A lot of things affect that. Your diet affects that. Your stress level, your hormones, all of those things can affect your hair growth. And so when I go in for my hair removal, I am not killing those growth cells. I am just slowing it down, getting rid of it a little at the time, but it does come back. And if I skip and do not go for a couple of months, I can definitely see a huge difference. Okay, so let's go more in depth about electrolysis. Okay, this is when a current is applied with a fine electrode. It can be painful, very painful, but things are coming, technology's come a long ways. So although it's painful now, it's not as painful as it once was. It can be very time consuming, and this is very expensive. You're talking about in the thousands. You do have to have a special license for this. You can look into your state and see exactly if this is in your scope of practice, or if you need more continuing education for electrolysis. But this is an option where it is going to kill all of those growth cells. Photoepilation. This is also known as an IPL, intense pulse light. It has very minimal side effects. It requires no needles. With needles, you know, you have that reduced risk, because when you take needles out of this, that is less infection, less chance for infection. All of those risks kind of fall to the wayside. It clears 50 to 60% of the hair in 12 weeks. This also, depending on your state, requires a separate license. Laser hair removal. This is rapid removal. When I go in for my laser hair, and this depends on, where you get laser hair removal at, I actually get it from my neck and parts of my face. It takes her about 3 minutes to do it. It's very, very fast. Once my hair is in the anagen phase, that is when she treats it. The best response is from coarse, dark hair. I have an autoimmune disorder that causes me to have this, and so it is the best treatment for what I have. It also requires specialized training. You do not have to have a certain license here in North Carolina. You can do this under our license. You just have to have specialized training. You have to be certified. Okay, so temporary hair removal. Temporary methods of hair removal, some of which may be offered in the salon or spa, are going to be discussed throughout this slide. First, we have shaving. All of us do this at some point. The most common form of temporary hair removal, particularly of men's facial hair, is shaving. Okay, most of us shave our legs. Some people take that a step further. Men, they shave more often than women for the most part. Another one is tweezing. Okay, tweezing is using the tweezers to remove hairs, commonly to shape the eyebrows. They can also be used to remove undesirable hairs from around the mouth and chin. Okay, so let's stop for a second and talk about the best shape for eyebrows, why I have this slide up. So you're going to determine the client's wishes for their final eyebrow shape. This is something that has gone out of control recently. I feel like over the past couple of years, eyebrows, microblading, waxing, shading, nano brows, all of these, brow lamination, it is skyrocketing, and people are loving these services, and they're paying top dollar for these services. So most everybody knows what kind of brow shape that they want, an ideal brow shape. Okay, you're going to hold the base of the comb or spatula against the corner of the nose. Okay, with the other end of the comb or spatula extending straight upward toward the eyebrow, and that's what is showing in this slide. This is where the brow should begin. Now, where the brow should end, which is what I call the brow tail, hold the comb or spatula so it extends from the corner of the nose outside the corner of the eye, and then across the eyebrow. The high point of the arch of the brow should be near the outside corner of the iris if the client is looking straight ahead. And I'm going to demonstrate this for you guys in class, but I definitely want you to see this. I'm one of those people, I do get microblading and a little bit of shading, and I have to do this because when I was younger, it was very popular to get your eyebrows waxed. Everybody had really, really thin eyebrows, super thin. And so I think I have damaged a lot of my follicles, so I have hardly any eyebrows now. And I definitely don't have the beginning of my eyebrows and the tails of my eyebrows. I just have a middle brow pretty much. And so this is very important, and this changes and can shape your entire face. Okay, next up, a deploratory is a substance usually that is a caustic alkali, so it's alkaline on the pH scale. It is used for temporary hair removal by dissolving it at the skin surface. And so you guys are familiar with this, I know, because you have probably heard of Nair or Veet or something along those lines. These are on the market. You can buy them in like Walgreens, Walmart. You can even get them at the beauty supply stores, where it is just temporary. You put on, some of them over the years they have come a long way, but some of them smell like burning skin. Basically, you put it on and your hair just kind of dissolves away at the surface. You're not killing any cells. It's not permanent, none of that. Now, an epilator, it removes the hair from the bottom of the follicle. Okay, an example of this is going to be wax. Wax is available in two forms. You have hard wax and you have soft wax. Soft wax is going to be applied to the skin and then removed using a fabric strip. Hard wax is thicker and it does not require a fabric strip for removal. An example of a waxing service that uses an epilator is a Brazilian bikini wax, which is also a technique that requires the removal of all hair from the front and back of the bikini area. Okay, safety precaution for waxing. I'm going to stop right there and talk about this for a second. So, for burns, you can definitely burn somebody when you're waxing, and I would be lying if I said I have not done that a time or two over the years before perfecting my skill at this, but it can be easily done. Always test the temperature of the heated wax before applying to the client's skin. This is very, very important. You guys do this with state board. It's just as important to do it when you have a live client. More important. Use a professional wax heater for warming your wax. Never heat the wax in a microwave or on a stovetop. And there are those manufacturers that want you to do that in a microwave. I have seen them. There are products on the market. Wax can become overheated and burn the client's skin. So make sure you test that wax, no matter if it's on their eyebrow, if it's on their bikini line, if it's on their lip, it can burn them. And with that burn, it's going to scab over. That burn could also cause infection, several different things. Okay. Make sure that you use caution so that the wax does not come in contact with the eyes. Never double dip. Okay. This is going to be an infection control issue. You know, if you take the spatula, spread the wax through the eyebrows, take that same spatula and go in your wax pot, that entire wax pot is now contaminated. Always use a new spatula. Do not apply wax over warts, moles, abrasions, or irritated or inflamed skin. Okay. The skin under the arms is sometimes very sensitive. It can be very thin. You want to use hard wax here for sure. Redness and swelling sometimes occurs after waxing sensitive skin. Apply an aloe gel or cool compress to calm and soothe the skin. Okay, so another temporary hair removal technique that we have is threading. Threading is also known as banding. It is a temporary hair removal method by where they take a cotton thread. It is twisted and rolled along the surface of the skin. It can be used to entwine the hair in the thread and lifting it from the follicle. And I know you guys have probably seen this. It's pretty cool to watch. There are people in the mall who do this, most of who are not licensed, but it is very quick. I have never actually had this done. People have told me that it's painful, but you know, that just depends on the person. I think tweezing is painful. I have very sensitive skin, so I don't wax my eyebrows. I think that's very painful. So pain tolerance has a lot to do with that. The last temporary hair removal that I want to discuss is sugaring. Sugaring involves the use of a thick sugar-based paste. It is essentially appropriate for sensitive skin types. Okay, so you apply it the same way. It's more of a paste that you can use on sensitive skin. Okay, so we have covered shaving, of course. Just to review, you can do this for men's facial hair. We do this on women's legs and underarms. It's very quick and convenient. It can cause irritation, ingrown hairs, and nicks from the blade. Again, all of that can cause infection as well. Okay, we talked about tweezing earlier, how to get that natural shape of the eyebrow. Again, consultation is going to be very important here to make sure your client is satisfied. Have them, show a picture. Then you also need to be familiar with, their facial shape and things like that. Is that brow going to look appealing on them? Okay, so what I'm talking about the front eyebrow here, if you'll notice, her nose right here, where it stops, right straight up is where your eyebrows should begin. They should end from the corner of your nose through the corner of your eye. And then your highest point, your arch, should be right here when the client is looking straight, right beside where their iris is. This is going to give them the most appealing and attractive look for their eyebrows. Okay, again, just a review, your depilatories, they are substances used for temporary removal. They do contain detergents, they contain adhesives, they expand the hair, so they go in there and they swell the hair. They break disulfide bonds, just like, you know, any chemical will do, your perms or your relaxers. They do require a patch test. Make sure you do this. There are a lot of allergies out there due to these. Okay, so your epilators, this is going to be your wax, hot or cold, soft, hard. Apply to brows, cheeks, chin, upper lip, arms, legs. Okay, and we just went over the safety precautions for waxing. Also, I'm going to introduce you, as I do a demonstration tonight, to the product lines. Here at the college, we have Satin Smooth, we have Gigi, and I think that we have one other product line that we use here for waxing. It has the aloe, it has the cooling, it has the post-wax, the all of that, the pre-cleanser. And so I'm going to show you the different products. There are several on the market, so you can get familiar with those as well. Okay, so here, this chart is in your book also, and it tells you, you know, what is best for each one: your back and shoulders, bikini line, arms, underarms, face, upper lips, eyebrows, legs, the tops of your feet and toes, which is a thing you would not think that it is. And it tells you, you know, what is best, which one of these is your temporary procedures is best for this. Threading, we talked about that a little bit while ago. It is practiced in Eastern cultures. It involves the manipulation of the thread. I want you guys to see this for sure. I'm going to pull up some YouTube videos so that you can see this. The problem with threading is finding someone that does this and meets infection control guidelines. A lot of the videos that I have found, a lot of the people that I see do this, don't do well with the infection control. You do have to have special training for this. You can do this, you're licensed to do this once you graduate and go before the North Carolina board, but you do need special training in order to do this. Sugaring. So I talked to you earlier about it being a thick sugar-based paste. This is mostly used for sensitive skin. It produces the same results as your wax. The residue afterwards is removed by dissolving that thick paste with warm water. All right, so I'm going to review a little bit more with you guys. So, removing hair at the skin line, such as shaving and chemical depilatories, is depilation. Epilation is removing the hair below the skin line. This is tweezing, waxing, electrolysis. As a licensed practitioner, you will be asked to remove unwanted hair, especially the eyebrows and facial hair. If you should choose to specialize in aesthetics, you will want to become more proficient in other hair removal services allowed by your regulatory agency. So what that means is you want to make sure that you go to the North Carolina board. Can I do sugaring in North Carolina? Can I do threading in North Carolina? What can I do with a laser as a licensed cosmetologist? What can I do? You know, can I do electrolysis as a licensed cosmetologist? Make sure you check into those things, and at any given time, those things can change. It is extremely important to follow cleaning and disinfection guidelines when removing unwanted hair. Again, you're breaking the skin a lot of times, most of the time, and when you do this, you know, infection can get in there, and that could be really bad really fast. Cleanse and dry the treatment area prior to treatment, and apply a cooling antiseptic afterwards. Again, I'm going to show you all of those different lines that we have. Follow all safety precautions to protect the client from the skin irritation or inflammation. Alrighty, guys. So that is all for chapter 22 as far as my lecture. I hope you enjoyed the lecture. Make sure you guys read the chapter. And make sure you guys study up on the procedures. I will be actually showing you some of these procedures this afternoon in lab. So you should be very familiar by the time you view this video, and it should connect some dots for you guys. Thank you.